Dry eye syndrome is one of the most underestimated problems in ophthalmology. Most people think of it as just temporary discomfort, something minor, something that can be tolerated or simply treated with drops. But the truth is that dry eye syndrome is a disease, and if it is ignored, it can lead to serious consequences. At Ko'z Nuri Clinic, we very often hear the same phrase, "Doctor, it's just dryness." People usually come when their eyes are already constantly burning, red, and getting tired very quickly, and when their vision noticeably worsens by the evening. And almost always it turns out that the problem has existed for a long time, but it was not taken seriously. It is very important to understand one key thing right away. Dry eye syndrome is not just a lack of tears. It is a problem with the quality and stability of the tear film. A tear is not just water. It is a complex structure made up of several layers, and each of these layers has its own function. Even if tears are produced in a normal amount, they can be unstable, evaporate too quickly, or spread unevenly over the surface of the eye. And in this case, the eye will still suffer. That is why dry eye syndrome can develop even when tear production is normal. A person may be surprised and say, "But I have tears." Yes, tears are present, but they are not performing their protective function the way they should. Why has dry eye syndrome become so common today? There are several reasons, and almost all of them are related to modern lifestyle. One of the main reasons is prolonged screen use. When we look at a computer, phone or tablet, we blink much less frequently. The tear film is renewed worse, evaporates faster, and the surface of the eye remains unprotected. A person may not notice this immediately, but the eye begins to suffer. Another important factor is air conditioning and dry air. In offices, cars, and at home, the tear film is constantly being dried out. This is especially noticeable in hot weather and during the heating season. The eyes are forced to constantly adapt to an unfavorable environment. Hormonal changes are another common cause. Dry eye syndrome often develops in women, especially during periods of hormonal changes. It can also appear in people with thyroid disorders and other endocrine problems. Medications should not be forgotten either. Some drugs that people take regularly and do not associate with eye problems can affect the tear film. Antihistamines, hormonal medications, antidepressants, and a number of other drugs can provoke or worsen dry eyes. How does dry eye syndrome manifest itself? Symptoms can vary, but most often people complain of burning and stinging sensations in the eyes. There is a feeling of sand or a foreign body in the eye. The eyes become red, especially in the evening. There is rapid eye fatigue and a feeling of heaviness. A very characteristic symptom is worsening of vision by the end of the day. In the morning, a person sees relatively well, but by evening, the image becomes less clear and blurred. At this point, many people start self-treatment. They buy moisturizing drops, use them from time to time, and think that this is enough. But the problem is that random drops do not treat dry eye syndrome. They may temporarily relieve symptoms, but they do not eliminate the cause. And sometimes incorrectly chosen drops can even make the condition worse. Without proper treatment, dry eye syndrome can lead to damage to the cornea. The surface of the eye becomes vulnerable, micro damage appears, inflammation develops, and the risk of infections increases. In severe cases, vision quality suffers, and the person experiences constant discomfort, even at rest. It is very important to understand this. An accurate diagnosis is possible only after a full examination. It is impossible to determine the type of dry eye by eye, or based only on sensations. At Ko'z Nuri Clinic, we perform special tests, evaluate the quantity and quality of tears, the stability of the tear film, and the condition of the cornea and eyelids. Only after that can we understand what type of dry eye syndrome we are dealing with. And this is critically important because modern treatment of dry eye syndrome is always individualized. There is no single universal drop that works for everyone. In one case, restoration of the tear film is required. In another, treatment of inflammation. In a third, work with the meibomian glands. In a fourth, correction of lifestyle and working conditions. At Ko'z Nuri Clinic, we always explain to our patients, dry eyes are a signal. This is not a minor issue and not temporary inconvenience. It is a condition that requires attention and a competent approach. The earlier proper treatment is started, the easier it is to restore comfort and protect the eyes from complications. If you notice burning, stinging, a feeling of sand, redness, rapid eye fatigue or worsening vision in the evening, do not ignore these symptoms. Write in the comments what sensations you experience and how long this has been going on. We read the comments and help you understand what to pay attention to. And if you want to clearly understand the cause of dryness and receive treatment that truly works, we are waiting for you at Ko'z Nuri Clinic. Here, you can undergo a full examination and receive an individual treatment plan aimed at preserving the health of your eyes. Dry eyes are not just discomfort. It is a disease that can and should be treated properly.